Good morning, Las Vegas. It's Zandra Pollard with It's Where I Am. Today, my guests are Dr. Brathwaite of Innovative Women's Care and Coach Amber. So, thank you, ladies, for coming on to the show. It is October, Cancer Awareness Month, and so I felt it was super important to have a professional here who deals with women's health care. So, Dr. Brathwaite, we'll start with you. I want to thank you for being here.
Thank you for having me.
And also, I want to get right into it. So, the mammogram, right? So, the first year I turned, or when I turned 40,
Right.
I got my very first mammogram. So, is that still the appropriate age to get your mammogram at 40?
Yes.
Okay. So, I got my first mammogram at 40, and they were tugging and pulling and touching, and it was a lot, but I got through it. I got it done. And so I was telling a friend of mine that, generally when women turn 40, it turns into like a celebration and advocacy to get other women to participate in getting their mammogram at age 40. So if you are 40 and above, please don't forget to get your mammogram before the end of the year. So, to continue on with my mammogram journey, I was told that I had dense breasts. So, what does that mean when your breasts are still dense after age 40?
It means you still have young people breasts.
Okay.
And so it's just a little harder for the radiologist to see through it. So they just want to make sure that you're aware that sometimes you might need additional imaging.
Right.
And the importance of getting a mammogram at 40 versus like 50, they changed it to 40 because before they were saying every other year at 50, but you decrease the risk of mortality by 57% by starting your mammograms at 40.
Oh, wow.
And African American women, they don't get breast cancer as often, but when they do get breast cancer, it's more aggressive. So, of course, early screening is going to help pick up things that you can't feel because some people feel, well, I did my breast examination, I didn't feel anything. But that's why you need a combination of both from your healthcare professional to have a breast exam and a mammogram because you can pick up, the mammogram picks up things that you don't feel. And like I had a patient today, she just had a mammogram, but today, she had it this year, but I felt 2 lumps in her breast. So she had just gone off the mammogram and been like, I just had my mammogram, so I don't need to get my breast exam. No, because sometimes we have to, if I feel something, then go back and address these targeted issues and make sure there's no cancer there.
Oh, wow. So you have your own practice,
Yes.
right? Here in Las Vegas. How long have you been here?
I've been in Las Vegas for 24 years
Oh, wow.
practicing.
Okay.
Yeah. Originally Canadian and went to medical school at Loma Linda in California. And then I trained at Martin Luther King Hospital and been in Las Vegas for 23 years. I started my healthcare professional journey at Southwest Medical.
Okay.
I was the chief of the OBGYN department for about 18 years. I was
Nice.
there for 23 years, and I started my own practice, Innovative Women's Care,
Yes.
a year ago. And we just moved down into, I was sharing a space for a while, and now we just moved down into our own facility the last couple months.
Wonderful. So where is your practice?
It's on Sahara and West Sahara in Buffalo,
Okay.
7650 West Sahara. And I have a big billboard with my face on it so you could see where we're at.
And so you can see how beautiful she is and how talented she is. And so make sure to get that mammogram done and get that yearly PAP,
Yes.
right? So you get it every year depending on your age. And then like if when you get older, is it every other year or how does that work?
So basically, I like to tell my patients you need an annual GYN exam every year. Because once you just say, like, well, you don't need a PAP for every 3 years or 5 years, then they think they don't need to come to see the gynecologist, and that's not true. So you need to see a gynecologist every year. And if you have 3 pap smears in a row, they may do a pap smear every 3 years or 5 years. But just like cervical cancer, African American women tend to get that more often. I tend to screen more often. And
Oh,
then you can discuss that with your healthcare professional about how often they want to be screening.
mhm.
But low risk patients probably need pap smear every 3 years, but you still need to see your gynecologist every year because you have to get your breast exam,
Okay.
and then you'll also have to get a pelvic exam and make sure you don't feel any ovarian masses. Ovarian cancer is very hard to detect, and there's no real screening test for that. So,
Okay.
time somebody's feeling a pelvic mass is kind of late with ovarian cancer. So, you need to always just have a breast exam, pelvic exam every year.
Oh, wow. Okay. I didn't know that. I want to give a shout out to the National Action Network Las Vegas chapter, President Bush. And I'd also like to give a shout out to Michelle Macy, the president of the SEIU. So that's how we met at
Mm-hmm.
one of their events.
Mm-hmm.
And I really appreciate you coming on, talking about women's issues. I'd like for you to also explain a little bit more about um, our vaginal system,
Mm-hmm.
right? So, is it true that your diet affects like what is so important about your diet and your vagina? How about that?
Absolutely. And
Okay.
people don't know that. When I tell them that all the time, bacterial vaginosis and yeast
Mhm.
infections have so much to do with your diet, you
Okay.
know. Um and then like for example, like diabetics can be more prone to yeast infections because of the sugar. Yeast loves sugar.
Okay.
Okay. So the pH in the vagina should be acidic. And then when it gets more alkaline, when certain conditions make it more alkaline, the natural bacteria and yeast that live in the vagina overgrow. So when you have too much sugar and carbs in your diet, being hot and sweaty right after sex or your period, that can make the pH in the vagina become more alkaline and make the bacteria in the vagina overgrow or the yeast overgrow. But
Okay.
especially yeast infection, it has a lot to do with the sugar and carbs in your diet.
Okay.
Hmm.
So what should we be adding to our diet? What should we make sure we have plenty of?
So you want to have plenty of anything that's going to make the pH in the vagina more acidic so that the yeast and bacteria that live there doesn't overgrow. If you like yogurt, it has
Okay.
okay, I don't like yogurt, but has natural acidophilus or lactobacillus,
Mhm.
or you can take an acidophilus supplement, or
Mhm.
like a vaginal probiotic to make the vagina more acidic. Some people use boric acid to make the vagina more acidic. Boric
Wait, like
acid,
sitting in it or
no, like suppositories. You can get boric
oh,
acid suppositories,
okay.
like you get out for Amazon, like to make the vagina more acidic, so that the yeast and the bacteria that lives it doesn't overgrow. To help counteract your lifestyle, maybe because sometimes it might be hard to cut down on sugar and carbs,
Mhm.
but especially for yeast infections, it has a lot to do with your diet.
Wow.
And increasing your water intake,
Mhm.
and just trying to keep that pH of your vagina more acidic.
Awesome. Well, cut the sugar, add more water, and eat some yogurt.
Yes.
So, again, can you tell us about your facility, where to find it, and the phone number?
Okay. So my office is called Innovative Women's Care. I'm a solo practitioner, but I'm getting a new partner on Monday.
Okay.
Dr. Tanisha Irvey is going to be joining me. I work out of the Smith Surgical Institute with Dr. Lane Smith. He's a plastic surgeon. I have my office in his building.
Okay.
Um, and it's on 7650 West Sahara.
Okay.
Um, it's the white building with blue windows, and my office is very girly, pink and gray.
Okay.
And yeah, so we've been there for a couple months, and we got a lot of good reviews, and very happy to be there.
Awesome. And we are glad you are there. And everyone who is listening, please know that Dr. Brathwaite awaits to see you. Okay.
And we take almost all insurances
Oh my
and
God.
self pay.
That's what I wanted to mention. So that was the purpose of my shout out and going to this event at the SEIU local union,
Mm-hmm.
right? So they were speaking about the disparities of healthcare,
Mm-hmm.
right? And you were one of the panel guests.
Yes.
So there was the issue that was brought up about insurances and Medicaid being an issue. Now, I come from a medical background and I know that Medicaid is golden
Mm-hmm.
because you're going to get paid,
Mm-hmm.
right?
Mm-hmm.
What were the issues that you spoke about? Can you please tell this audience about
What I said that day.
that you said that day about people receiving care who have certain insurances.
Right. Um, I guess we were talking about whether or not, Medicaid pays. They may be slow to pay, and they may not pay for everything like infertility and things, but
Okay.
generally they pay. But I think a lot of it also has to do with the provider deciding whether or not to take Medicaid because they may not want that social demographics in their office. So
Right.
some people may choose not to take that insurance. But they generally Medicaid can today they usually approve a lot of what the patients need,
Right.
and they can get their care done.
And Dr. Brathwaite, as she said, takes all insurance, most insurance, and self pay. So
Mm-hmm.
she's there to help. Now, I want to bring in my next guest. Coach Amber is here. And Coach Amber is a life coach, and she does not take insurance. She does do self pay, right? Is it called self pay? Self pay. But what I've learned is she is a super great asset to your life and your business life, right? Can you explain more to us what it's like to hire a Coach Amber and what comes with that?
Absolutely. Well, welcome. Thank you for having me on the show. So, a life coach is just like a sports coach. When you hire a sports coach, that your team is better, you become a better performer. So, as a life coach dealing with me, I will help you identify areas where you may be stagnant or maybe stuck at, and then we create a strategic plan that helps move you forward. And I keep you accountable, kind of keep you targeted to meet those goals. So, as overall, especially balancing your work-life balance. I work with a lot of women in leadership and high achieving women. So it's very hard to balance those things in your life, or you kind of miss things. So having a coach comes in, helps create a plan, a strategy, a schedule, regimens, so that you're not missing anything, or you're not having that burnout where you're exhausted from trying to maintain home and work. And so as an asset to being a coach, those are the areas where I help you focus and recognize, hey, this area you're doing more here. Let's kind of balance it out and create a plan and move you forward so you can actually reach all the goals that you truly desire and really live a life that you want to be fulfilled in and love your life. Because a lot of women, I speak more to women, is we are chasing the success, we're chasing the ladder, but sometimes it's on the wrong building. So
Okay.
our family life may be suffering, our kids might have to suffer because you're chasing that success ladder and there's no balance. Or yourself, a lot of self-care. As a doctor is here, a lot of women in leadership and success forget to schedule their doctor's appointments, see a doctor regularly,
Right.
and all of those things are so important. Mental health, all of those things. So as a coach, those are the areas that I help you focus on and recognize where we can create the balance at.
Okay, so in that explanation, can you tell us the difference between a therapist and a life coach?
Absolutely. So the way I like to see things, I think a therapist deals more with past traumas. And then as a coach, we kind of identify where you are right now and help you strategize to move you forward. So we're not really focused on what's happened to you, but where you are right now
Okay.
and creating a plan to move you forward to whatever focus goal you are looking to obtain in that moment. So we're more future focused, as I think I would say maybe therapists focus more on past tense kind of things.
Sure.
But I believe therapy and coaching go hand in hand because as you're moving and hitting goals, a lot of times things will come up and you'll recognize fears, doubts, triggers. And I like to help identify that, but I'm not going to help you process through that.
Okay.
And so that's kind of where therapy would be. Your best bet is to deal with those traumas that maybe you never even dealt with or you've been running from. And maybe that's what's hindering you from actually meeting a certain level or hitting that ceiling because you haven't dealt with the past. So that's the difference between coaching and therapy.
Okay, well, that makes sense. And then I'm thinking too, as you're speaking, like, what if someone's therapy has kind of like timed out, right?
Yeah.
Like, what if their insurance only pays for so many visits and then they need continued care? Or what if, they've recognized their trauma and they're ready to move forward past it, right? And then
Right.
that's when you come into
And
play.
that's the
Okay.
perfect time. I like to work with people that are committed and ready to move forward, because coaching is not it's not therapy. It's like, let's get these goals. I want to see you accomplish it. I'm like your cheerleader in the
Okay.
background. I'm here to help you move forward into meeting that mark, whatever that is for you, whether it be life or whether it be work, or business or entrepreneurship. It's moving the needle forward, not sitting stagnant or sitting still.
Okay. So I would think that you're able to help people with their personal life and their business life. This is what I'm understanding. Are you able to then work with organizations and like be a part of the payroll, let's say, um, to get on board to like help with also like staffing or the staffer issues?
Absolutely. So, like, conflict resolution,
Okay.
basic life skills, a lot of times, are getting back the momentum. So, a company would hire me to bring that momentum into to their company, bring back the basics, like the morale, professionalism, basic personal skills,
Okay.
a lot of things that sometimes we get comfortable in our jobs that are forgotten. It's a great asset to a company to bring in a coach that says, hey, let's get some goals in place. Let's get the morale back up. Let's create this professionalism,
Hmm.
community, unity. A lot of times is when coaches are hired. For my company, I would have an invoice. So you're kind of like a contractor when they
Okay.
bring you in onto their companies.
Okay. Okay. Now, do you also help those businesses who are just starting, or do they have to already be established for a person of your, you know, caliber to come in?
It does depend on budget, but
Okay.
I have a lot of entrepreneurs, because as we do kind of the personal work, a lot of my clients recognize, like, I do have a business idea, or I kind of been doing a side business, and I
Mm-hmm.
help them create that plan, and let's create into a business. Let's get the start of it. I wouldn't call myself a business coach, but I know a few things that can help get your goals clear, get a
Okay.
plan that strategizes. A lot of times it's just getting clear on what it is that you want to do.
Mm-hmm.
And as transitioning, sometimes you just need the clarity in the blueprint, and that's where I come in as well.
Oh, wow.
Yes.
Okay. I love it.
Thank you.
So I was asking that question because I was wondering if a person such as myself, who was in her beginning stages of her LLC,
Yeah,
would be able to render your services, or would
absolutely.
you appoint me to an assistant?
No, I would absolutely. I'm definitely still very hands on with my clients.
Okay.
Um, but it's all about strategizing and being clear. So in the beginning is a perfect time, because it's all about what goals we want to meet. So just creating that plan is the most important part, and being clear about it.
Okay, so if you have a business out there and you're doing well, then maybe Coach Amber will give you the time of day. That's what it sounds like to
Absolutely.
me.
I give 15-minute free consultations.
Okay.
So, yes, we can definitely have a conversation. And also, you want to make sure, just like with the therapy or with the doctor, that you guys mesh well, so that you can actually see the accomplishments and see the transformation take place. That is also important.
I love it. I love it. So, how do people find you?
So I am on all social medias as Coach Amber J, or you can go to my website, coachamberj.com. There you can book a 15-minute free consultation, coachamberj.com.
All right. I love it.
Thank you.
So glad and so happy to have you all here.
Thank you.
Want to let the audience know what's going on with me. Okay. I am having a women's empowerment conference this November 5th at 10:30 a.m. The doors will open here at UNLV in the Greenspun building. Hope that you come out and see us. I know Dr. Brathwaite will be there. She will be one of our panelists. So inviting you all to come. Also, we have Dr. Brathwaite has something else that she knows of that's happening in October.
On
What is
October
it?
15th, at Dr. May's Complete OBGYN Care,
Okay.
they're having a breast cancer um, car parade. So then they meet at her office,
Okay.
and they're having their cars decorated for breast cancer, and then everybody drives down to the strip and that's on October the 15th.
Oh, beautiful. So tell us again, where do they meet and what time?
On October the 15th,
Okay.
and they're meeting at Complete OBGYN Care.
Okay.
Yeah.
All righty. So let's all meet up there and go down the strip with our cars decorated and celebrate Cancer Awareness Month. All righty. So, Dr. Brathwaite, can you give us that information again for the Cancer Awareness Month parade?
Yes. It's on the 5th Annual Caravan Mammogram Parade at my friend's office. We'll be joining them. It's Saturday, October 15th at Las Vegas All Women's Care at 8 a.m.
Awesome. So meet at 8 a.m., get your car decorated,
Right.
and join the parade. So before I let my guests go, I want to get back with you, Dr. Brathwaite, about trusting your physician, feeling comfortable with them. Some more of the disparities that are out there. So can you give us more about that?
Yes, it's been studied and acknowledged that there is health inequality with African American women. And at my office at Innovative Women's Care, 702-413-7740, we see a lot of African women patients looking for African women doctors.
Yes.
And they come and tell me that, they're looking for somebody that's going to listen to them and understand them. And it's been studied that if you trust your healthcare professional and you share common experiences or the fact that they listen to you and open up to you, you will have better healthcare and have better health outcomes.
Right.
So it's, and they don't necessarily have to look like you, but you do want to find somebody that you can trust and that you trust what they're saying. And because then you'll just be more open with what's going on with your health.
Exactly.
And you'll be more honest. And then you feel like the more knowledge that the doctor has about you to help you. And then you also want to have buy-in. What creates a good patient-doctor relationship is having the patient have a buy-in on their treatment plan.
Right.
Be totally transparent what's going on with them and get their input on what, on what their options are and what their treatment plan is.
Yeah, because it's that comfortability, right? So I know cultural differences. Sometimes people don't open up and ask questions because maybe culture, maybe they don't even know what to say. They're not comfortable. All of these different variables, right? So I completely get what you're saying. Now, I did want to say, I'm sorry, Amber, 1 second. I just wanted to ask her one more thing about fibroids
Yes.
and people of color or women of color and fibroids. It's a really big issue.
Yes.
Yeah.
Fibroids are very common in African American women. One out of every 2 African American women have fibroids. And they're benign tumors, less than 1% can be cancerous, turn into a leiomyosarcoma.
Okay.
And those are the ones that grow really big into your abdomen. But they can cause problems with irregular bleeding, pelvic pain, pressure, fertility when they get really big. But it is the one medical condition that women get surgical intervention for more often than anything else. It's the most common cause of hysterectomies. But they have some new medications to help with bleeding, and there's also like a uterine fibroid foundation.
Okay.
And then there's also new technology like robotic hysterectomy. If you do have to get a hysterectomy, you don't have to, like bigger uteruses before, you would have to be totally open. I can take out a huge uterus with the robot.
Oh,
Yeah,
yes.
and you go home the same day. You don't have to stay overnight anymore. It takes time, it takes skill. Not everybody is robotically trained with the Da Vinci. But me and my partner, Dr. Irvi, are robotically trained surgeons.
All right.
So if you have any issues with fibroids, we don't always just jump to a hysterectomy, and we'll discuss different options with you. But if you do need to have surgery, that you will know that at Innovative Women's Care, we are robotically trained surgeons.
Beautiful, beautiful. Coach Amber, I know there's something else you want to share.
Well, I wanted to ask the doctor a question about having that care with, or what questions should you be asking your physician? Because I know sometimes I actually just recently went to the doctor, and until she started asking me things, I didn't even think about those things to be wrong. So is there like a patient doctor questionnaire that we should be asking, or that would be helpful for that comfortability to even start?
Yeah, most times when you go to the doctor's office, they'll give you a questionnaire to ask you about like what's going on with you, and then your past medical history, and then you have to just be open about whether or not what medications you use, your social history, about if you use alcohol, drugs, or whatever, because that's all going to be in the management of your care, and as well as your past medical history. So, and then the more questions the doctor asks, it can jumpstart for you to ask questions or know what to tell the doctor. You just need somebody that's going to spend the time to talk to you, and that's the thing about finding somebody to spend the time. So sometimes in my office, patients might be waiting, but I'm talking.
Yeah.
I'm a little chatty, and I talk to my patients. But otherwise you can go in, do your PAP, and get out, and leave.
Yeah.
But if you want a doctor that's going to listen to you and treat you and know everything, then you'll find a doctor that's going to take time to listen to you and talk to you.
And you'll go to Innovative Women's Care. And so we're going to have her on the resource page of my website. You can find her there. I want to thank Coach Amber and Dr. Brathwaite again for being here. Please know that you can find the show on Apple, Spotify, Google, and Apple Podcasts, and also my YouTube channel, It's Where I Am. So I will see you next month, second Saturday of the month at 8:30 a.m. It's Zandra Pollard. It's Where I Am. Bye.